I am so pleased to announce our next presenter. Marina Curzio is one of our psychosocial oncology clinicians here at CancerCare Manitoba, and she is going to present on the topic of mindfulness. So I'm going to hand over the microphone to you, Marina. Welcome.
Thank you, Cheryl, and good morning, everyone. I hope you had a great break. Like Cheryl said, my name is Marina. I'm one of the counselors here at CancerCare. We're also called Psychosocial Oncology Clinicians. I've been with CancerCare for almost 2 years now. Prior to that, I worked in community mental health, and my background is in psychiatric nursing, just so everybody knows. So, welcome to this presentation. I will get the slides up for everybody so we can see. Where are we here? Okay, bear with me. Okay, here we are. Yes, so again, welcome to this presentation on mindfulness. I'm assuming some people or most people have heard of mindfulness. It's been a popular term or buzzword in our culture, society in the last few years. If not, that is okay. And I know most people have different experiences and knowledge with mindfulness. So really my priority today is just focusing on the foundation, focusing on those introductory concepts, and we're also going to do a little bit of practice as well. And just of note, there is so much to learn about mindfulness. This is really just scratching the surface. There's so many different areas to go down and different insights to gain or challenges to have. And I'm still really learning daily about mindfulness. So I just wanted to preface with that this is not the whole thing. This is just a little bit of what mindfulness can be. And so to get started, I wanted to emphasize the main purpose of mindfulness, and that is really to be in the present moment, to be in the here and now, kind of taking time to reflect on what that means for you and how that shows up in your life. And so next I wanted to start with a little example. I got this from a worksheet that I give out to some of my clients just to get them uh, introduced, sorry, to mindfulness. And so I wanted to get you thinking of an everyday example that most people can relate to. Have you ever noticed when you're driving your car, when you're doing a repetitive or familiar task like driving your car, doing the dishes, doing the laundry, that your mind is often miles away thinking about something else? You may be fantasizing about going on a vacation. You might be worried about an upcoming appointment or a scan, or you might be replaying a certain interaction that happened. And in those moments, you're really not focusing on your current experience and you're not in touch with the present or the here and now. And this way of operating is really called the automatic pilot mode, which is very common. I think we all do it. I think it's instinctual, really. And I still find myself doing it quite often. And so mindfulness is the opposite of automatic pilot mode and becoming more aware. Again, it's about becoming in the here and now, being more present and experiencing life in that way. And so this way is sometimes referred to as the being mode. And mindfulness will offer ways to kind of free ourselves from that automatic thinking, unhelpful ways of thinking and responding, and we'll talk more about that as time goes on, but that's just a little way to get you thinking about what mindfulness is. And I've added a little picture of the red panda here. He looks like he is or he or she is comfortable, maybe meditating, being a little bit relaxed, mindful, and they're really just my favorite animal. So I just wanted to start off with a little happy note. So my equity commitment in preparing for this presentation, I've considered the health equity resource for presenters provided by the Conference Planning Committee. This was provided to help presenters reflect on how these topics and content can have good effects or bad effects on people or populations that are underserved. Again, that's why I kind of went with the introduction just to so it could be utilized for everybody. Presenter disclosure, I really don't have anything to disclose, although I do work at CancerCare Manitoba. I'm employed through them, but no other financial sponsors. So the learning objectives for today, it's pretty basic. We're going to start with what is mindfulness, what are the key concepts of mindfulness, then we'll explore different kinds of mindfulness, how can you implement that, understanding the stress response. We'll talk a little bit about that, really basic about the stress response and coping. And then we'll do two practice exercises and I'll provide some resources at the end. Okay. So we are going to start with a practice exercise, and this one is called mindful breathing. And this is one we start off with at the beginning, because it's more focusing on the breath, which is kind of foundational to mindfulness. So I would encourage everybody to find a comfortable place wherever you are. You can sit, you can stand, or you can sit or you can lay down, whatever works best for you. And then I'm going to guide you through a mindfulness breathing. And I put a picture of Lake Moraine here. I went there for the first time this summer, and it was so picturesque and just the beauty of it. I just wanted us to have that in our mind before we started this exercise. Okay, I will get started. So find a comfortable sitting posture. Put your feet flat on the ground and try to straighten your back. Gently close your eyes. Let your shoulders drop down and away from your ears. Pay attention to your breathing and just allow yourself to continue to breathe naturally. Now, rest your hands gently on your belly with the fingertips of each hand lightly touching in the middle. Breathe in smoothly through your nose and exhale slowly through your mouth. Continue to take slow, smooth breaths. When you breathe in, notice your belly push your hands gently apart as you fill your lower lungs with air. When you breathe out, notice your belly sink backwards, back towards your spine as you release your breath. You can imagine that your belly is a balloon. Fill it in with air and then watch it deflate. Now continue to focus on the gentle inhalation and exhalation of your breath, in and out. If any other thoughts or images come into your mind during this exercise, just notice them and gently bring your attention back to your breath. You may also become aware of physical sensations or feelings in your body. Simply notice them and then again, bring your mind back to your breath. You don't need to analyze or give these thoughts or feelings any meaning in this moment. Simply acknowledge them without judgment and bring your mind back to your breath. It's normal for your mind to wander. Simply notice that your mind has wandered and gently bring your attention back to your breath. Continue to focus on your breathing and stay in this relaxed state for as long as you like. When you are ready, slowly open your eyes and bring your attention back to your surroundings. Okay, and that was the end of the exercise. I was hoping people could just take a moment to reflect on that, just pause. You can think about it, you can write down what you're thinking. I wanted to ask a few questions. So, what was that like for you? Was it uncomfortable? Was it relaxing? Was it difficult? Was it easy? And then was there anything that you noticed? Any bodily sensations, any temperatures, anything really? There's no right or wrong answer. There's no right or wrong answer. It's just whatever you noticed. Just taking time to reflect on that. And just a heads up, I like to mention this, but sometimes people misunderstand mindfulness or get frustrated when they first start learning about mindfulness, thinking it means you need to focus on one thing and you're doing it wrong if your mind wanders. But your mind will wander to other things. It's very normal. And your job is to gently bring it back into focus when you can. It's not about getting it right, it's not about perfection. That's something I want to really highlight. This is an important skill, but it takes time to practice. I still have to incorporate it every single day, but we'll talk more about that. Okay, so next we will go to the roots of mindfulness. So where did mindfulness start at? So like I said, there's been an increase of attention about mindfulness in the past 3 decades. Lots of talk in our culture, but in many Buddhist traditions, there has been a 2,500-year history of incorporating mindfulness interventions into everyday life. That's where we really saw it begin. And mindfulness is now studied as secular. So this means it's unrelated or neutral with religion or spirituality. Other researchers say that secular means it's accepting of all faith traditions because some people see mindfulness as already embedded into all religions and spirituality um, as part of their traditions. It's just not named as mindfulness. So however you kind of want to see secular, it's really about being a part. It's a part of being a human being on earth. That's how they're studying it now. John Kabat-Zinn, who I would say is a pioneer or a guru, uh, highly respected researcher and practitioner, developed the 8 week mindfulness based stress reduction program at the University of Massachusetts Medical Center in the 1970s. So he first started it off based off of his practice. He saw it could help people and patients who are experiencing chronic pain, and it is now being applied to a variety of populations. It's being applied to diverse backgrounds, people with different worldviews, children, adolescents, young adults, older people. It's really for everybody now, and of course for people experiencing cancer and for their caregivers as well. Just wanted to mention that. And there's been rigorous research and systematic review completed by many researchers which support the efficacy of mindfulness based intervention with those living with cancer and other illnesses. Lots of the information I provide in this presentation is from the book Mindfulness Based Cancer Recovery, which I really enjoyed. I thought it was well description of mindfulness, and it really laid down the basics. And that is by Dr. Linda Carlson and Dr. Michael Specka, who both have extensive knowledge regarding mindfulness and both work at the University of Calgary as associate professors in psychosocial oncology. And their book was adapted from John Kabat-Zinn's mindfulness-based stress reduction program, and they include mindfulness and meditative practices. I also put a picture of the garlic roots there, just to have a visual description or depiction, sorry, of the roots, how it started in those Buddhist traditions, and now it's really being it's blossoming into all different areas, and it's really undefined of where it can go right now. So mindfulness defined, I put two different definitions here just to see if one resonated with somebody more than the other. There's lots of different interpretations of mindfulness, but these two are the main ones. This one from John Kabat-Zinn, I would say, is the most popular, and that is paying attention in a particular way on purpose in the present moment, non-judgmentally. And then Carlson writes, paying attention to whatever comes up in the present moment, allowing it to rise and fall of its own accord without trying to change or control anything, and being with things as they are. I personally liked that one because life is so much about the ups and downs and all arounds, and it's really about, yeah, trying to stay in that present moment and not trying to control everything, which is difficult, which is really, really hard. And mindfulness, I just wanted to stress, is a basic human ability within all of us, allowing us to be aware, to be more present, being aware of our thoughts, our feelings, our physical sensations, and hopefully leading us to be less reactive or overwhelmed with what's going on around us. And although this can be a simple concept, it may seem very simple, it's very hard to put into practice. It's a daily or a weekly or however often you want to do it kind of thing. And it's a skill that builds over time. It's a journey. It's really a journey and a process. It's not a destination. It's not something you can go out and acquire. You can't go buy it, unfortunately. It's just something that we have to start building into our lives. And it's really non-linear. You know, I have good and bad days with mindfulness, and my clients as well, who I've seen utilize it, or and my colleagues, like everybody. Okay. So, what are the key components of mindfulness? I put it here in two different ways. So, I put a visual description and then also the definitions, just to see how they're all separate but all interconnected to kind of bring mindfulness to life. So, openness, being curious, being non-judgmental, using an open mind, however that means to you. Having intention. This is kind of my biggest one that I utilize, and that's purposely trying to increase awareness and focus on your experience. So, bringing in that wandering mind and having that intention, whatever that means to you, however that looks. Attention. This is directing, listening, watching, observing, and considering what is naturally existing in front of you at each moment. And this can involve our senses. So, having that attention. And it's really about, again, that present moment. So not being too far in the future, not being too far in the back. Really trying to be there while being open, having intention, and trying to focus your attention as much as you can. Okay. So, helpful attitudes for practicing mindfulness. I really like this one. Um, just having this attitude from the beginning can be really helpful for people. So, using a beginner's mind, going step by step, not thinking you're advanced because it's a simple concept. It's just taking it one moment at a time, and that's what a lot of my clients utilize for the cancer experience in general. Is taking it one moment at a time, taking it one step at a time, one appointment at a time. Whatever works best for you can be applied to mindfulness as well. Approaching the practice as an interesting adventure. I like this one. Being curious, being playful. It doesn't have to be serious. It can be if you want to, but it can be interesting as well. Being gentle with yourself, big one. I think we can all be kinder to ourselves in this world right now, especially. Not expecting too much, not thinking you're going to master it right away, taking time, trying to have fun, like I said, like having a little bit of playful. And I really like this one, connecting with gratitude, connecting with wonder, connecting with delight. I love those terms. I really think those are so helpful to do or try to. And it can look different every time, every day. It doesn't have to be every day. It can be once a month where you're connecting with that. But being open to that can be really helpful um, for myself and for some clients. Just kind of going back to the basics, hey, is really what it's all about. Okay, so what are some mindfulness practices? So this is more organized, just to kind of get it into different categories. So we have formal practices, and then we also have informal practices. So formal is setting aside time to purposely practice, having that intention, saying, okay, I'm going to sit down for a 10-minute mindfulness exercise right now. Is kind of what that means. Meditation, so sitting or lying down. So that was kind of the exercise we did earlier. Um, but there's so many different meditations and it can be guided. You can do it on your own. I prefer to someone guide me. It's easier that way, but everybody's different at different stages. A body scan, which we'll do at the end of this presentation, and that's becoming more aware of our bodily sensations, scanning our body, seeing how we're feeling, becoming in touch with that. Yoga, I'm sure most people have heard about yoga, and you can adapt this to whatever physical state you're in or mobility or whatever. There's lots of adaptations. Even just doing simple yoga can be really helpful for people, and focusing on the breath. Also, what we did earlier, people setting aside time to do breathing exercises when they're feeling overwhelmed, incorporating that breathing. And then informal, so remembering up to apply awareness at any time. I like this one. It's when you're having a busy day and all of a sudden, oh, it clicks in your mind. Okay, I need to apply this right now. Becoming more aware, slowing down, again, not being in that high paced, stressful life that our culture likes to promote, slowing down, bringing it one step at a time, accepting what is happening. So, being in the reality, I wanted to kind of talk about accepting a little bit. And that is about being open to the reality of the present moment. It involves a conscious decision to abandon one's agenda, to have a different experience. And it's an active process of allowing current thoughts, feelings, and sensations, both good and bad, without judgment. It's important to note that accepting does not mean you're giving up. It doesn't mean you're being passive. It's acknowledging your reality without fighting it. So I just wanted to just emphasize that a little bit. And then incorporating it into everyday activities. We'll talk about that on the next slide. Yes. So everyday activities. So we can all incorporate this. Everyone is able to start doing this if it works for you. So for walking, um, when you're walking anywhere, if you're going for a walk, if you're walking in the store, anything like that, being aware of those, of your foot on the ground, just those little things, moving your muscles, taking each step, looking around, what's in your nature, what's in your environment, being more aware. When you're eating or drinking, I really like this one. This is really more slowing down. Are you tasting what you're eating or drinking? Are you feeling the texture? Are you smelling the smells? Just those little things. Rather than rushing to get to our next task, taking time um, to experience those bodily sensations when you're eating or drinking. Doing the laundry, we talked about this at the beginning. Are you feeling the texture of the materials? Are you looking at the colors of the materials? Are you aware of the smells? Just anything really. It's unlimited, whatever you want to become aware of. Waiting in line. I like this one because we often get quite frustrated when we're in line waiting and we have somewhere to be, and it's easy to become a little, I don't know if agitated is the right word, irritable maybe. Um, so taking time to become aware of that breath in that moment, looking at the textures, looking at your environment, little things like that can be really helpful rather than getting upset. Shower or bathing. I also apparently I like all of these. So shower or bathing. Feeling the water, feeling the temperature of the water, feeling it go down your body. All of those things, rather than thinking about, okay, I have to do this, and this today, and taking that time for you is really what that is. So those are all really ways, um, and there's unlimited ways really, but those are the main ones that I wanted to focus on today, to incorporate mindfulness into your everyday living. It doesn't necessarily be need to be a meditation that you go sit down and do for 10 minutes sort of thing. Okay, so now we'll talk about the stress response. And I'm sure most people have heard about some of this, so it might be just a review, but for some it might be new. And so sometimes people first reaction when they hear cancer care has a stress reduction program, or that maybe stress caused the cancer, maybe it was their fault. Therefore, maybe it is now their job to beat the cancer by changing the way they view stress. And I just wanted to emphasize that that way of viewing cancer is not helpful or accurate. Everybody experiences stress. It is a normal human experience. Everyone throughout the world, throughout human race, has can or sorry sorry has stress, and it comes from within us. And so the definition for psychological stress or distress is when we judge the coping demands of a situation to exceed our abilities to cope with the situation. At times we may be selling ourselves short but underestimating our real capacities. And I wanted to say this quote from Mark Twain that I really liked, and I could resonate with it, so I'm sure other people could too. So he says, I have been through some difficult things in my life, some of which have actually happened. I'll say it one more time. I have been through some difficult things in my life, some of which has actually happened. And so we can become aware of our full range of personal stress response, and learn to recognize them in action. So during human history, the stress response was developed in people and other species as an automatic way of helping us protect ourselves from physical, immediate life or death danger. No thought was necessary, and it was very useful at that time when facing a threat to our physical safety, such as a predator, for example. And so the stress response has also been called the fight, flight, or freeze response, because when our body perceives a threat, it prepares itself to do one of three things: stay and fight the threat, get away from the threat, or brace ourselves to minimize impact. So it's important to remember that we don't choose to have a fight, flight, or freeze response, or which of these responses we have. The body chooses the response, and we are still likely to need this if we are facing physical danger. So it's still needed within humans. It takes training and experience to have a strategic response alongside the stress response. And so nowadays we have more of that ongoing kind of chronic stress that we experience, having kids, taking care of family members, work, a million different things. So we have more other reactions or stress reactions now, that I wanted to kind of briefly go through and just get everybody to think about which ones kind of show up for you in your life. This list is not exhaustive, but it's just some of them to get you thinking about how stress is showing up in your life or has shown up in your life, whatever works for you. So, for physical reactions, we can be getting headaches, racing heart, back pain, indigestion. For emotional, we could be crying, we could be nervous, angry, lonely, and feeling overwhelmed of pressure. Behavioral, so this could include smoking, compulsive eating or drinking, bossiness. For cognitive, some of our reactions could be memory loss, some could be indecisive, worry, trouble thinking clearly. And for spiritual, It could be emptiness, a loss of direction, loss of meaning, and unforgiving of yourself and others. And relational. So that could be isolating yourself, hiding, feeling resentful, having distrust. Sorry. So thinking about that, see how many are in each category. Is one category was more than the other? If there was none in some and lots in the other, just taking time to reflect on that. And then once you start reflecting on those responses and reactions, you can start thinking of how, when, and why those reactions show up in your life. And a lot of times, those behaviors or those reactions, sorry, are become patterns and really habits in our life. So it's good to start becoming aware of that. And of note, when cancer is a part of your life, the fear and stress can be something you deal with a lot. Obviously, worrying about the cancer progressing or the cancer returning, worries about scans, which my clients like to call scanxiety. These are all very relevant fears that we don't want to pretend don't exist. They do. We also don't want to think about the fear constantly every day. So trying to have that balance, not having it be on your mind at all times is kind of the thought there. So how can mindfulness affect our stress and coping? And mindfulness can really help everyone learn ways to respond or deal with life's complex events, the ups and downs of life, I like to call it. So remember the stress response so you can understand what's happening in your body and mind. When you can pause between feelings and reactions, it encourages us to slow down for a bit, take a pause, and then act after objectively evaluating a situation. This allows us to have access to a wider range of personal resources. We're able to respond more creatively. That's in line with our values, and you can replace bad habits like I talked about earlier and become more flexible. Um, Again, this it takes practice. I'll give one example that lots of us can relate to. So a traffic example, when we're in traffic and out of nowhere someone cuts you off and starts gesturing at you. There's a few different ways you could react. I'll talk about the first two that probably come to our mind is shout, defend yourself, get angry, however that looks for you, or we can take time to pause, think to yourself, okay, wow, this person is not having a good day. Take the high road, have sympathy, and let them in. You know, taking that time to pause and say, how am I going to react to this? Although sometimes in those moments we have that automatic reaction, but yeah, taking that time to pause and see if you can react in a different way. Because sometimes getting upset is really hurting more yourself in those situations. And again, this is all about practice, practice, practice. It doesn't happen in a day, or you might not agree with that situation of the traffic example, but different situations where you see yourself reacting, if you can apply it to that. And recognizing the coping strategies that work for you, this can be really helpful. I know it's helped for me. And knowing that not all coping styles are effective in all situations. So it's really trial and error, seeing what works best for us. Researchers have put coping into two different categories, more the problem focused coping and then the emotional focused coping. So problem focused is more about being prepared, trying to solve a problem. If you know you get anxious before an appointment, going early, going with a support person, having a drink that you like in the appointment, writing down your questions, that sort of thing, establishing healthy relationships and boundaries with your work, just trying to more practical, like problem based coping. And then emotion based coping, this can include more self care, incorporating into your everyday, having a nice warm bath, being active, listening to music, art. I'm sure most of us do this already. It's just kind of naming it and applying it when you need to, sort of thing. Okay, so how does mindfulness show up at Cancer Care? We have two groups that focus on mindfulness specifically. We have a mindfulness practice group. This is an 8-week program for cancer patients and their families over Zoom. It's based on the mindfulness based stress reduction model created by John Kabat-Zinn that I talked about earlier. It's facilitated by psychologist Dr. Debbie Whitney. and I facilitate it with her. She does the actual facilitating. I'm more of the, she has the training. I'm the logistics person, but it can be really helpful for people. We also have the cognitive behavioral therapy with mindfulness, and this is a 6 week psychoeducation group for cancer patients and their families. Again, it's for everybody. And this can be a hybrid model online and in person. It's more about how our thoughts, feelings, and behaviors are all interconnected and bodily sensations, but they also incorporate mindfulness in there to be aware of that present moment, gain that awareness sort of thing. And then also, I'm sure you've all heard about our individual counseling, and they can provide information on mindfulness as well. And if you wanted to practice mindfulness in your counseling sessions, you could for sure ask for that. So, the benefits of mindfulness, I won't spend too much time on this. Like I said, there's been lots of rigorous research done regarding the benefits of mindfulness. Lots of people see an enhanced quality of life. I know I have. It can help with improving your mental, physical health, and your overall well being. It can increase your self regulation skills and decrease your response reactivity, like we just talked about. And with that, it improves our interpersonal relationships. Sometimes we can have more boundaries, our communication can get better, we know what energy we want in our lives, that sort of thing. And they've also found that it helps with coping with cancer related symptoms and side effects. Most notably, in that book that I read, they talk about how it can help with pain, your self image, identity, and fatigue and nausea. Even sometimes just changing the way you think about it can be helpful as well. And so, what are the resources? I put a few resources here that everyone can take time to write down if you would like. These are apps you can get on your phone. Um, some of them have a subscription free, some of them have free trials and free options. So we have Headspace, we have Balance, we have Calm, Insight Timer, and I just heard about this one, the Healthy Mind Innovation, and I just downloaded it. It's completely free. Everything in there is free, and they have it's evidence based with great researchers involved in the project. I quite liked that one. And they also have a website too if you wanted to look that up. And these can be helpful to have on your phone so you can utilize it if you need to. I really like it before bed. Some people like it first thing in the morning. Everyone is different. Seeing what works for you. And some exercises can be 2 minutes, some 10 minutes, whatever works. These are also some resources that you can write down the website if you would like. The Patient and Family Resource Center, which I'm sure you've heard about. They have lots of books, CDs, DVDs, resources on mindfulness and all other topics. And then the Wellspring Cancer Support, the website is there, and that's self paced resources, including stuff on mindfulness. Okay, and now we are at the end. We will do our last exercise. So we'll do the body scan, and for some people, it might be hard to focus on certain areas of your body based off of treatments or feeling betrayed by your body. I hear that one a lot. So if it gets overwhelming, please go to a different part of your body or go back to the breath. Don't do it if it's feeling overwhelming. And sometimes it can take time to create that loving kindness with our body again. So begin by feeling the weight of your body on your chair. Notice the points of contact between that and your body. Become aware of the sensations of your breath. You may feel the breath going in and out of your nostrils or passing through the back of your throat, or feel the chest or belly rising and falling. When you're ready, move your awareness down into the big toe of your left foot. Notice the sensations in your big toe with a sense of curiosity. Is it warm or cold? Now expand your awareness to your little toe, then all the toes in between. What do they feel like? If you can't feel any sensation, that's okay. As you breathe, imagine the breath going down your body and into your toes. As you breathe out, imagine the breath going back up your body and out of your nose. Use this strategy of breathing into and out of each part to which you're paying attention. Expand your awareness to the sole of your foot. Focus on the ball and heel of your foot, the weight of the heel, the sides and upper part of the foot, the ankle. Breathe into the whole of the left foot. Then, when you're ready, go to the left foot. Repeat this process of gentle, kind, curious, accepting awareness with the lower part of the left leg, the knee, and the upper part of the left leg. Now, Gently shift your awareness around and down the right leg to the toes in your right foot. Move your awareness up the right leg in the same way as before. Let it go, then let it go. Move up to the lower torso, the lower abdomen, and lower back. Notice the movement of the lower abdomen as you breathe in and out. Notice any emotions you feel here. See if you can explore and accept your feelings as they are. Bring your attention to your chest and upper back. Feel your rib cage rising and falling as you breathe in and out. Be mindful of your heart beating if you can. Go to both arms, beginning with the fingertips and moving up to the shoulders. Breathe into and out of each body part before you move to the next one, if that feels helpful. Focus on your neck. Move your mindful attention to your jaws. Feel your lips, inside of your mouth, your cheeks, your nose, your eyelids, your eyes, temples, forehead, and checking if you're frowning, your eyes, the back of your head, and finally the top of your head. Gently bring your attention back to the room and slowly open your eyes. So taking a moment to reflect again like we did at the beginning, I'll ask the same questions that you can think about. So how was that for you? Was it was it easy? Was it difficult? Was it uncomfortable? Was it interesting? And was there anything that you noticed? Anything different than you noticed from the first time? Anything new? Did you notice the same thing? Good questions to ask yourself. And again, there's no right answer. Okay. And my take home messages for today are quite simple. Everyone can try and practice mindfulness. You can incorporate it into your everyday activities. It doesn't have to be set out for you, it can be in any way you want. And it's not a destination, but rather a process or a practice. Remember, you can't go out and buy it. It's really something you have to incorporate. And be kind to yourself. That's the biggest one that I have, being kind to yourself. So thank you. And welcome back, Cheryl.
Marina, oh my goodness, what a presentation. You covered both the practical things about what to know about mindfulness, plus with that experiential exercise. Thank you so much. And I don't know if you could
Welcome.
see, but there's some applause and like icons that are coming up.
Thanks,
And
everyone.
I'm just looking, we have a couple of minutes for Q&A, and I think we have some big thinkers in the audience.
Oh,
So,
I like big
but
thinkers.
I know. Well, the first one is I am near the end of my breast cancer treatment, and the brain fog continues despite my best efforts in terms of mindfulness. Will the brain fog ever get better?
Ooh, good question.
Mhm.
Everyone is different from what I've seen with the brain fog. I've seen some people get a lot better as time goes on. Sometimes it takes a few years after the end of treatment before they feel that. And then sometimes they can notice little changes here and there. Like I said, once you start incorporating it, then I really like to celebrate the small wins. Even if it doesn't feel like you're progressing at the rate that you want it to, even if you notice little things at the beginning, can be really helpful to get to feel that progress. But I can't say for sure if it'll get better, but from what I've seen, overall, most people do experience progress with the brain fog.
Yeah, as a fellow counselor, I would second what Marina has noticed. It
Mhm.
sometimes is hard to see progress until you kind of look backwards. But thank you for that question. I hope it gives you some encouragement.
Yes.
And another final one, Marina, what's your experience with non-dual, no mind versus mindful practices? So
Non-dual.
yeah, that sounds very existential. Yeah,
I'm
I'm
not
one.
sure what that is.
Yeah, I'm sure that this particular person has had some experience with different types of modalities
Yeah.
of mindfulness. So yeah, a good one that I think both of us are a little bit.
Hmm. And does that mean, yeah, not having any thoughts? Maybe that's the question.
Oh,
Non-dual.
that's how I'm interpreting it too. Like more of the no thoughts coming in at all, which I know I'm not there. I don't know
I'm
about
not
you,
there.
Marina.
I'm not that experienced yet, but I'm sure there are people like I know Dr. Debbie Whitney, who I run the uh, mindfulness practice group with. She might be at that level, but yeah, I'm not there yet. But I think maybe sometimes people that is their goal, but But yeah, I don't have experience, so I can't say.
Yeah, I would guess
Unfortunately.
it would take years and years, and
Yep.
maybe the asker has that experience over
Yeah.
us. So, um, and lastly, there is one quick one, Marina, before we let everybody go for lunch.
Yep.
But there was a question in the feed. Another big thinker, existential
Hmm.
thinker. Is stress really from within, or is stress external and our responses from within?
Good question. I like that. And maybe it's both, and maybe it depends, I think, on all of our experiences, our childhood, our the trauma that we've had, our interpretations. But for me, that's how I see it, is it is from within. And when I work with my clients, it's from within too. But of course, there are those external factors and some triggers maybe that can act up for us. But having that power within ourselves, empowering ourselves that we do have some control over our reactions and things like that, that's where I was maybe coming from, um overall, if that makes sense for you. But I see where you're coming from, and I think you can have that interpretation as well.
Absolutely. It's almost like a philosophy class here.
Yes, it is. I love that.
Yes, great questions. You've got us all thinking, everybody, and some applause in the Q&A box as well as we're seeing come up. Marina, thank you so
Of
much for that
course.
presentation.